the other technique that we could use here along the medial foot is a pure distraction technique. Okay, so to do this, we need to block, scooch up just a touch, there you go, perfect. Block the superior bone, right? So in this case, for the talonavicular joint, I need to get my towel roll onto the talus, onto the neck of the talus. Okay, I'm going to start on the medial foot here, and I'm going to slide my hand down until I'm on the navicular, right? Got a nice firm grip here. And then the actual technique is a percussion. I'm going to hit my hand to produce traction. Okay, so here, pull down. Just don't hit their foot. Okay? And you can actually use that technique for any of these frontal plane joints, as long as you then change your fixation. So I can move my fixation down to the navicular, change my grasp hand to the medial cuneiform, traction, thump it. Move my position, my fixation down to the medial cuneiform, move my grasping hand down to the first metatarsal, traction, thump it. So for any of the medial foot frontal plane joints, you can use that technique. Actually, super effective, super safe for the patient, because it's just a distraction technique, right? Distractions generally are the safest manipulations we can do. Now, here's a little tip. One of the things that a lot of people have, especially that I just mentioned, for instance, with one of the patients I've had in the past, is they've got sweaty feet. And sometimes it's not easy to get a good grip. Taking a small piece of TheraBand and putting it over the skin, that will give you a very good grip. Okay, because the last thing you want is to hit this and have your hand just slide right off and yank their toe off their foot. Right? You don't want to end up grabbing onto something like that. Any questions there? No? Okay.
Will we